Hello and welcome again. This is Dr. Naj, and today we're going to learn a little bit about periodontal diseases. Since it's a big theme, we will try and divide it into 2 to 3 videos, making this one the first part. I hope you enjoy, and if you have any questions, please feel free to ask in the comment section or by texting me on Instagram at doctor.khaldoun. It's written right down below. Yeah, so it should be noted though that periodontal diseases have nothing to do with pulpitis that we saw in prior videos. Let's start. So as you can see here, we have a healthy gum, then we've got gingivitis, periodontitis, advanced periodontitis, and then leads to the tooth loss. Yes, the 5 stages of gum disease. So what occurs prior to this serious disease known as periodontitis that may lead to tooth loss, as you can see over here? Well, if you have gum disease, your gums may bleed when you brush your teeth and you may have bad breath. This early stage of gum disease is known as gingivitis. If gingivitis isn't treated, a condition called periodontitis that we just spoke about develop, which affect more tissues that support your teeth and hold them in place. Today, we're going to learn about gingivitis, which is the first disease, periodontal diseases. So gingivitis, as you can see over here, it's a form of gum disease characterized by a reversible, good thing it's a reversible, gingival inflammation without destruction of tooth supporting tissues, periodontal ligament or bone. That is what differentiates it from periodontitis. So, as you can see over here, the longer plaque and tartar are on teeth, the more harmful they become, since the bacteria then infect tissue surrounding the tooth, causing inflammation around the tooth, leading to periodontal disease. So basically, when bacteria stay on the teeth for long enough, they form a film called plaque, which eventually hardens to tartar, also called calculus, which infect tissue surrounding the tooth. So now let's move on to the symptoms and types. So we've got 2 types, right? The plaque-induced gingival diseases and non-induced plaque gingival diseases. We are mainly going to talk about the plaque-induced gingival diseases since they are more common, more than 80%. So as you can see over here, we can diagnose the so-called gingivitis by checking the patient's gums. You can see there is a difference, right, between the normal gingiva, the mild gingivitis, moderate, and severe. And as you can see, they are more red than the normal gums. So there is an increase also in the volume, a change in their structure, and most importantly, they all bleed. They have a tendency to bleed in, unlike the normal gingiva. When it's healthy, it doesn't tend to bleed when you're brushing your teeth. And this is one of the first symptoms of gingivitis, is when you're brushing your teeth and you notice that they are bleeding very easily. So, just like pulpitis, gingivitis also divides into acute and chronic, localized and generalized. So, localized and generalized, I think they are understood, meaning one tooth or the gingiva in general. So, and the mild, moderate, and severe, we all just saw them here. And for acute and chronic, so basically the difference between acute and chronic gingivitis is that chronic gingivitis comes from the biofilm plaque that covers the teeth and causes inflammation, while acute gingivitis usually comes from specific infection or trauma to the gums. As for the diagnosis, we've got the medical history. By medical history, it's like the medical history helps us identify the underlying risk or conditions. Also factors such as smoking that might contribute to gum disease, and examination of the gums to see and check if they bleed easily, and to use a probe to check the depth of the pockets. If they are between 1 to 3 millimeters, that means they are healthy. Let's move on to the causes. So, because plaque-induced gingivitis is by far the most common form of gingival diseases, we will mainly focus on it. So the bacteria in these calculus produce chemicals such as degradative enzymes and toxins such as lipopolysaccharide, otherwise known as endotoxin or LTA, that promote an inflammatory response in the gum tissue. This inflammation can cause an enlargement of the gingiva, at subsequent formation. Early plaque in health consists of a relatively simple bacterial community dominated by gram-positive cocci and rods. As plaque matures and gingivitis develops, the communities become increasingly complex with higher proportions of gram-negative rods. The focus of the treatment is to remove the plaque. So therapy is aimed at the reduction of oral bacteria, and it may take the form of visiting the dentist with adequate oral hygiene home care. So several of the methods used in the prevention of gingivitis can also be used for the treatment of manifest gingivitis, such as scaling, curettage, mouthwashes containing chlorhexidine or hydrogen peroxide, flossing. Just a note, power toothbrushes work better than manual toothbrushes in reducing gingivitis. The active ingredient that reduce plaque and demonstrates the effective reduction of gingival inflammation over a period of time are triclosan, chlorhexidine digluconate, and a combination of thymol, menthol, eucalyptol, and methyl salicylate. These ingredients are found in toothpaste and mouthwash. So the bacteria that causes gingivitis can be controlled by using an oral irrigator daily with a mouthwash containing an antibiotic, either amoxicillin, cefalixin, minoxidil in 500 grams of non-alcoholic fluoride mouthwash in an effective mixture. This marks the end of our video. Thank you so much for watching. If you have any questions, please make sure to ask in the comment section or text me on Instagram at doctor.khaldoun.